Sometimes, when we're managing pain, we need to use morphine, and patients and families are very nervous or anxious or reluctant to take morphine. Could you talk about the challenges you face sometimes in prescribing morphine to people who are afraid to take it?
Yeah, I think morphine and related medications are the most important element in our approach to pain management. And as you quite rightly identified, there's a great deal of misinformation, a great deal of fear and apprehension, and it's very understandable. And the reason is simply that in past generations, morphine and other opioid medications were reserved strictly for use only at a time when patients were very close to their death. So the association between the use of morphine and the patient's death became very closely entwined. And that time association developed into a cause and effect association, such that family members will say to you, well, my father started morphine at 5 o'clock in the evening and he died before midnight. And the assumption is somehow that the morphine contributed to the death. Indeed, sometimes much more strongly than that the morphine very directly caused the death. In other words, had he not had the morphine, he wouldn't have died. And that is a great pity, because morphine, when used under careful clinical supervision, in the clinical context, is one of the very safest drugs that we have. It's infinitely safer, for example, than paracetamol. And we know this from extensive studies and extensive use right across the world. People have all kinds of fears relating to tolerance. So they believe that if I take morphine for my pain now, should it deteriorate and get worse later on, I'll have nothing in reserve. They fear they're going to become addicted. They fear they're going to become compromised, excessively sleepy, they can't drive, they can't function. And none of these fears are well founded. Absolutely not. Morphine is an incredibly easy drug to use, a very safe drug to use, and it can really transform the lives of individuals. All of the best evidence suggests that it should be used by mouth whenever it can, but in circumstances where a patient cannot take the drug by mouth, such as might happen, for example, if they couldn't swallow, or if they were vomiting excessively, these kind of problems, or indeed if they were too weak so that they couldn't take any medication, then you have the option of delivering the morphine underneath the skin by an infusion, a subcutaneous infusion. And that is a very easy and effective way to deliver morphine to the body. But provided the dose is carefully chosen and is balanced against the pain severity, we simply do not see the types of problems that people fear the most. In fact, it's even worse than that, in the sense that the longer a person has uncontrolled pain, the more difficult it becomes ultimately to get that pain under good control, and the higher the doses that will be required. So it's an extraordinarily safe drug. It's an extraordinarily effective drug. And this has been recognised in the medical literature going back to the 1600s and before. Thomas Sydenham wrote in 1680, amongst the remedies which it has blessed Almighty God to give to mankind, there is none so universally efficacious as opium. And that evidence has been there. A lot of the work that Cicely Saunders did in the 1960s, presented to the Royal Society of Medicine, demonstrated the safety and the efficacy of morphine and related opioid medications. We have a phenomenal amount of experience in this area. But unfortunately, there is a very major hiatus between the evidence, the research evidence, and the perception. And the perception and the negative attitudes towards opioids and the fear, indeed the phobia in relation to opioids, is as deeply ingrained in healthcare professionals, some would say even more so, than it is in the general population. We know more about these medications. We've used them for longer than just about any other medication that any doctor will ever use in any situation. They are extraordinarily safe and extraordinarily effective.